continuation of the integrated functions of the shoulder complex. So, with about description, you have to understand that if at all there is a structural limitations or inability of a muscles to appropriately stabilize the scapula, what will happen? Exactly opposite of the normal function, which is the normal function is posterior tipping and external rotation during elevation, and uh, there is an upward rotation of the scapula. Three things should happen. There should be a posterior tipping, there should be external rotation, and there should be upward rotation of the scapula. These three things will not happen. So whenever there is structural limitation of inability or weakness of any of the muscles which are meant to stabilize the scapula, what will happen? The opposite, that is anterior tipping, internal rotation, and downward rotation of the scapula with attempted flexion of the. So normally during flexion of the arm, what should happen? Posterior tipping, external rotation, and upward rotation of scapula. So any person coming with a shoulder joint pain will have this condition. So now we'll understand what we have to do is we have to prevent this function from happening, and to make it to normal biomechanical function. That is the main idea, to prevent shoulder complex injuries. So we have already discussed about the scapulothoracic and the glenohumeral integrated joint function to glenohumeral functions. Now we'll go to the sternoclavicular and acromoclavicular contribution, which has a major contribution to in the normal biomechanics of shoulder complex. Elevation of the arm in any plane involves motion of the, so whatever may be the plane of motion, whether the arm is moving in for flexion or abduction, in both this sternoclavicular and acromoclavicular joints has to produce scapulothoracic joint motion, because we know that scapulothoracic joint is a functional joint. It is not an anatomical joint. So when you're talking about scapular thoracic joint movement, either the joint axis anatomically has to be in the sternoclavicular joint or in the acromoclavicular joint. So that's why the combined functions of sternoclavicular and acromoclavicular joint motions are very important for this scapulothoracic joint movement, which is in a closed chain mechanism. Given the complexity of the linkages, these we can call it as a chain linkages. So the proximal sternoclavicular, then the acromoclavicular, and then the scapulothoracic joint, then distal to that is a glenohumeral joint. So then after that also you have the other joints such as elbow, and this goes on like that. So here it is a linkage. There is no consensus on the relative contribution of the sternoclavicular and acromoclavicular joints to the 60 degrees of arc of upward rotation of the scapula as the scapula moves through its full range of motion. Okay, there are different thoughts which is happening in this 60 degree of arc of rotation. So the initial the scapulothoracic upward rotation as the arm is flexed or abducted in both actions such as flexion or abduction appears to be caused by clavicular elevation at the sternoclavicular joint. The first movement for any in any plane, whether it's flexion or in abduction of the humerus, the scapulothoracic joint rotation, upward rotation, this upward rotation, initial upward rotation of the arm it is caused by the clavicular elevation in the sternoclavicular joint. That next there is a figure, we can see that again in the figure. This scapular upward rotation occurs around an approximately anterior posterior axis. This scapular upward rotation means the initial scapular upward rotation which happens in the sternum, that is in the clavicular elevation of the sternoclavicular joint. The axis passes anterior posterior, passing through the costoclavicular ligament, that is the ligament between the clavicle and the first rib. There is a strong ligament which is passing through. So the axis is in that area and projecting backwards through the root of the scapular spine. So root of the scapular spine, the base of the spine is the scapulothoracic motion. The first scapulothoracic motion happens with the in the sternoclavicular joint, where in the anterior posterior axis through the costoclavicular ligament, and this axis coming backward is projected backward through the root of the scapular spine in the scapulothoracic motion. As the elevation of the arm progresses, the scapulothoracic axis of rotation gradually shifts outward, laterally reaching the acromioclavicular joint in the final range of scapular upward rotation. Now see this. Initially, what we know, so this is the normal position. The scapula, we can see here it is given like a mechanical joint so that you understand. This is the sternoclavicular joint. This is a clavicle and this is attached, the clavicle, the proximal end is attached to the clavicle. So here what happens is the first scapular upward rotation, what you can see is the scapula from this position moving to this position. The movement happens only in sternoclavicular, the elevation of the, here the clavicle is elevated, and this elevation solely happens in the sternoclavicular joint. Here once more you have to remember that according to the biomechanical this thing, the axis is in the costoclavicular. The axis should be somewhere, it should be somewhere between here, so that it is between the clavicle and the first rib. So the axis should be somewhere here. The figure is showing a bit different, but you have to imagine that it has to be here, and then it will and it moves through the root of the base of the spine. That is this area where it is, the root of the spine. This is the root of the spine. This is the spine, and then this is the acromion process. So here what they're saying is, so during each movement, so from here it is moving to this position. See, now you can see the scapula move to this position. From there again there has to be another movement, but that movement happens in the acromioclavicular joint. See, now this is a normal resting position. From there the first movement happens like this, upward rotation. So this is a posterior tipping, upward rotation, and external rotation has to happen. Now then what happens is the movement again happens in the scapulothoracic joint. This upward rotation is happening here. You can see the upward rotation happens here, and this happens in purely in the acromioclavicular joint. So this is a bit. So normally what is happening is, here it is in this axis between the costoclavicular ligament and the root of the. Then it is moving towards laterally, then coming outward. So here it comes here, then laterally. From here it moves to the this area, then to this area, and then laterally the joint comes to the this area in the final hyperabduction. The major shift in the axis of rotation happens because the scapulothoracic joint motion can occur only through a combination of motions at the sternoclavicular and acromioclavicular joints. I just once again remind you that you cannot write ST and SC. You have to write scapulothoracic, sternoclavicular, and acromioclavicular joint. No short forms. Here only to fit this into inside the PPT. When the axis of scapular upward rotation is near to the root of the scapular spine, the ST motion is primarily a function of sternoclavicular joint motion. Already I have described that. This is only for you to prepare your notes. When the axis of the scapular rotation is at the AC joint, the AC joint motions predominate, and when the axis of scapular upward rotation is in the intermediate position, both the sternoclavicular and AC joints are contributing to the scapulothoracic motion. We can say that whenever the axis is in the sternoclavicular joint and in the root of the spine of the scapula, means that the sternoclavicular joint has a major role to play. Whenever you can say that the joint axis in the scapular upward rotation comes to the acromioclavicular joint, that then a major joint motion happens in the AC joint. So if the axis is in between the root and the acromioclavicular joint, means that both the sternoclavicular joint as well as the acromioclavicular joint play equal role, play an integrated equal role to have a good smooth shoulder function. The scapulothoracic upward rotation occurs both as the lateral end of the S-shaped clavicle flips up and as the tension in the coracoclavicular ligament is reduced. to permit upward rotation of the AC joint. So when this happens, the scapulothoracic joint upward rotation occurs at the lateral end of the S-shaped clavicle. That means when the joint root of the axis comes to the root of the joint axis of the scapular thoracic rotation comes to the acromoclavicular joint, then what happens that that tension builds up in the where does the tension build up in the sternoclavicular joint because of the tension building up in the coracoclavicular ligament becoming taut, and because of this it gives a tension to the clavicular ligament, does not allow any permit any upward rotation of the AC joint. So here what will happen is the S-shaped clavicle flips. There is a rotation of the clavicle, not the elevation. So this rotation helps in the movement, the permission. It permits a movement in the AC joint. So the clavicle, the middle end of the clavicle, the coracoclavicular ligament goes for tight, and then this is reduced. This length tension is reduced, and movement is permitted in the AC joint because of the rotation of the clavicle. The magnitude of posterior rotation of the clavicle may be any so that the type of rotation is posterior rotation. For that I have already, if you remember my students, when we had studied the sternoclavicular joint, I asked you to put your left hands, two fingers onto your superior, on the anterior surface of the medial clavicle near the sternoclavicular joint, and then asked you to do a abduction of the humerus, hyperabduction or abduction of the humerus. You can feel the posteriorly rotating clavicle. So you have to understand all these movements are very essential. These knowledge will help you to solve. I have already told you that any patient in future comes with a shoulder pain to you, you have to start with sternoclavicular joint. You have to start with all the motions of the sternoclavicular joint, all the motions of the acromoclavicular joint, all the motions of the scapulothoracic joint, and then only go to the glenohumeral joint. First you solve all the normal functions of these joints, and then if you go to the glenohumeral joint, it will be easy. So the patient will feel, you can see that how the patient is getting relieved. The pain relief is very quick. The magnitude of posterior rotation of the clavicle is anywhere between 30 degrees to 50 degrees or 55 degrees. As the scapula adjusts to differing contour of the rib cage, the AC joint allows varying amount of anterior bar posterior tipping and internal bar external rotation. The tipping action, which is anterior posterior tipping of the scapula, and the internal and external rotation, all of this happens in which anatomical joint? It happens in the acromoclavicular joint. The scapular adjustment to the contour of the rib, which is both two contour, that is the longitudinal contour of the thorax and the anterior posterior, the sidewise anterior posterior contour of the thorax. Both are the shape of the scapula itself is helpful in contouring. Also the motion of the acromoclavicular joint, as I have earlier studied this in the acromoclavicular joint. The magnitude of acromoclavicular joint motion can be expected to differ among flexion, scapular plane abduction, frontal plane abduction of the arm, as well as to differ with variations in scapular resting position, rib cage configuration, and muscle dynamics. Even though we have discussed all about the acromoclavicular joint motions, these terms, which are the importance into normal functions of the acromoclavicular joint, what are they? That is scapular plane abduction, frontal plane abduction of the arm, as well as to varying different the scapular, the resting position of scapula, the rib cage configuration, and the muscle dynamics. Now we are coming to the next this one, that is we are going to the discussing about the upward rotators of the scapula. Now we are discussing about the acromoclavicular. So mainly what we are discussing here is the motion of scapula. So important motion for the normal biomechanics is the upward rotators of the scapula. So we will discuss in the next part.